A very good evening to one and all. On behalf of the Embassy of India Kuwait, I, Saida Misbah, welcome you all to today's symposium on combating COVID-19 variants. A warm welcome to Ambassador of India to Kuwait, His Excellency Shri C.B. George, Dr. Amir Ahmed, President of Indian Doctors Forum, our panelists consisting of leading medical experts in Kuwait, Dr. P. Shankar Narayan Menon, Dr. Arjit Chattopadhyay, Dr. Saroj Bala Grover, Dr. Varki Alexander, and Dr. Shanti Alexander. I also welcome all the participants who have joined us live and media fraternity. As we all know, right from the time the coronavirus pandemic struck the world, India emerged as the first provider of humanitarian assistance and emergency medical supplies to several countries in the world. India has exported over 6.6 crore doses of vaccines to over 90 countries, including 2 lakh supplies to Kuwait, strengthening the ties between India and Kuwait. Today's symposium on COVID-19 variants is an outreach effort of the Embassy of India to highlight the latest information and efforts of scientific community in combating COVID-19 and its various strains. Without further delay, let us begin our program. May I now request Ambassador of India to Kuwait, His Excellency Shri C.B. George, to deliver the inaugural address. Welcome, sir.
President of Indian Doctors Forum, Dr. Amir Ahmed, our moderator for the symposium today, Dr. P. Shankar Narayan Menon, our panelists, Dr. Arjit Chattopadhyay, Dr. Saroj Bala Grover, Dr. Varki Alexander, and Dr. Shanti Alexander, other senior doctors who are joined us today, distinguished guests, ladies and gentlemen, a very good evening to all. Welcome to Embassy of India for this virtual event. I begin my address today by thanking His Highness Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, Amir of the State of Kuwait, and His Highness Sheikh Mishal Al Ahmad Al Jaber Al Sabah, Crown Prince of the State of Kuwait, for hosting the large Indian community in Kuwait and for the care and support the government and the people of Kuwait extend to the Indian community during the COVID-19 pandemic. I congratulate Indian Doctors Forum and its president, Dr. Amir Ahmed, and all its members, especially the panel of doctors who are here to conduct the symposium on an extremely important subject, combating COVID-19 variants. 2 years on, the battle against this pandemic continues to perplex everyone, everywhere in the world. It was a very difficult last 2 years for all of us. Many of us thought that 2022 would be a better year with the COVID-19 behind us, but it does not seem to be. We are now faced with a new and fast-spreading variant, Omicron. Experts say more variants are likely to come. And we are here to continue our fight against COVID-19 in 2022. India and Kuwait are partners in the fight against COVID-19 pandemic. You recall the cooperation we had when India sent the emergency medical team to Kuwait in April 2020. Dispatched Made in India vaccines to Kuwait in February 2021, and Kuwait supplied medical oxygen in May last year to India. Our leadership has been in regular touch, reviewing our bilateral engagement. Today morning also our foreign ministers had a telephonic conversation. Dear friends, I urge all members of the Indian community in Kuwait to strictly follow the COVID-19 guidelines set by the government of Kuwait. We in the embassy organize all our events only virtually till the situation improves. We have a series of virtual events scheduled for next week, January 23rd, unveiling of the portrait of Netaji Subhash Chandra Bose to mark his 125th birth anniversary. Jan 24th, my open house with the community, and Jan 26th, of course, our Republic Day celebrations. All are invited to join these events virtually. Here we are today again on our virtual platform with our partner, Indian Doctors Forum, to generate awareness on the new variant and other variants. We have been regularly doing such events with IDF to generate awareness among our community and others. I would like to thank IDF for being in the forefront of fight against 19 pandemic in Kuwait. They have worked closely with the embassy in many activities, be it organization of dedicated seminars, awareness campaigns, roundtable discussions to educate people about COVID-19, or by conducting medical camps or free medical consultations. IDF doctors conduct free medical camps at the embassy shelter every fortnight. I recall the humanitarian service IDF as an organization, and our doctors collectively and individually have given to the community during the pandemic, along with our nurses and other medical professionals. I also thank each one of our frontline warriors, our doctors, our nurses, and other medical professionals, without whose dedication and commitment we would not have been able to beat this virus. Now, with this new variant spreading, IDF has already come up with a panel of over 50 doctors in multiple languages of India for free telemedical consultations. Dear friends, India, like other nations, have also experienced the fury of this deadly infection, including the new variant. But we are facing this situation with great fortitude and resilience. A year from the date of launch of the world's largest vaccine campaign, we successfully administered 160 crore, that is 1.6 billion COVID-19 vaccine doses, an unparalleled global feat. While we fight this pandemic domestically, India continues to be at the forefront of the global fight against COVID in line with its civilizational ethos. To mention one latest example, last week, India supplied the third batch of medical assistance consisting of 2 tons of essential life-saving medicines to Afghanistan. India had recently supplied 500,000 doses of COVID-19 vaccine and 1.6 tons of medical assistance to Afghanistan through WHO. In coming weeks, we would be supplying more batches of humanitarian assistance consisting of medicines and food grains to Afghanistan. India is guided by the vision One Earth, One Health in saving crores of lives by providing necessary medicines and vaccines to many countries. By rising to the challenge of the day, we have rightly justified the tag of being the pharmacy of the world. Our healthcare professionals, our doctors, nurses, paramedics, scientists have been saving lives and winning trust, respect, and hearts of peoples across the world with their experience, professionalism, and above all, human touch and care. While we are fighting this pandemic, our collective resolve and struggle with the strong support of the government has also ensured that our economy has forged ahead in these challenging times in India. Dear friends, I once again congratulate the entire IDF team, its president Dr. Amir Ahmad, and the entire team who are part of this COVID-19 awareness campaign. I now look forward to hearing from the panel of our experts who have joined us here today. Thank you, be safe, and stay blessed.
Thank you very much, sir. Moving ahead, may I now invite Dr. Amir Ahmed, President of Indian Doctors Forum, to explain the theme of the symposium and introduce all our panelists of the symposium today. I also invite all our esteemed panel of experts to occupy their respective seats on the stage. A warm welcome to all of you.
Honorable Ambassador of India, Shri C.B. George, officials at the Embassy of India, our expert panelist, ladies and gentlemen, Assalamu alaikum, good evening, namaskar. We are certainly going through difficult times. As the Honorable Ambassador mentioned, we thought 2022 would begin with COVID being left far, far behind. But COVID still persists, and we don't know how long it will continue to do so. That's the million-dollar question. The Indian expat community here in Kuwait is the largest expat community. We are nearly 30% of the entire Kuwait population. So it is but imperative upon us not to put overload on the health facilities of our host country. It is definitely very heartening to see our ambassador and the team of officers at the embassy to organize such lectures, awareness campaigns, so that the Indian diaspora who's staying here in Kuwait can get awareness, can educate themselves, and take the preventive aspects and follow them so that there is no extra load on the health structure here in Kuwait. This is our third symposium on COVID. And there are still many questions that need to be answered. As the seminar goes ahead, I would request the audience, if they have any queries in their mind, to write it down in the chat box. We have our IDF office bearers, Dr. Jagannath, Dr. Asit, Dr. Nazim, Dr. Sajna, Dr. Aparna, all seated over here. And they'll be noting down your questions, and that will be forwarded and will be answered. Each and every question will be answered. Today we are indeed very blessed to have an expert panelist. And this scientific seminar will be chaired by Dr. P. Shankar Narayan Menon, sir. Dr. P.S.N. Menon, sir, is a consultant pediatrician, and he is the head of the Department of Pediatrics at Armed Forces Hospital. It gives me great pleasure in welcoming Professor P.S.N. Menon to this seminar. Dr. Alexander Verkey. He's a consultant in the Department of Internal Medicine, and he is working at Sabah Hospital under Ministry of Health. Sir, it gives us great pleasure in welcoming you to the seminar. Dr. Arjit Chattopadhyay. Dr. Arjit is a consultant endocrinologist, and he works at Sabah Hospital under the Ministry of Health. We have great pleasure in welcoming Dr. Arjit to the seminar. Dr. Saroj Bala Grover. Dr. Saroj is a senior physician working with the Infectious Disease Hospital. It gives me great pleasure in welcoming Dr. Saroj to this seminar. Dr. Shanti Alexander, consultant pediatrician working at Jahara Hospital, Ministry of Health. It gives me great pleasure to welcome Dr. Shanti Alexander to this seminar. So we all are ready for this very interesting, very meaningful seminar, the topic of the day. As I mentioned, please put your questions in the chat box and they all will be answered. So without much ado, once again thanking the Honorable Ambassador, Shri C.B. George, and the embassy officials for this initiative and expressing our Indian Doctors Forum's, thanks, gratefulness to be able to associate with such programs. So with these few words, I leave the session to be moderated by Professor P.S.N. Menon. Thank you.
Good afternoon, everybody. me first acknowledge the appreciation and the sincere thanks of the entire panelists to the Indian Embassy, represented by the Honorable Ambassador Mr. C.B. George, and also our parent association, the Indian Doctors Forum, represented by our President, Dr. Amir Ahmad. This is indeed a very important venture in the milestones of combating COVID-19 disease in Kuwait, as well as for our Indian community and the world in general. Because what we are going to cover today is not only applicable to Kuwait, but is all for all humanity. Situations may be different, but the challenges remain the same. This is not a new topic. We, under the ambience of the Indian Doctors Forum and the banner of the Indian Embassy, we have covered several aspects of the management and the newer advances in vaccination and other healthcare measures that are to be taken during an endemic as well as a pandemic over a period of 2 years. This is the third webinar of the series. It is not only webinars that we are doing, we are also coming out with material, both written as well as online, in the form of a health guide prepared by our esteemed members, edited by my colleagues in the group, Dr. Saroj Bala Grover and Dr. Arijit Chattopadhyay, which is an extremely useful and accepted guide for day-to-day management of COVID disease in the country. It is still, even though it was published in 2021, it is still a vademecum for everybody to follow and refer to in the day-to-day management of COVID, including even your queries on vaccination. And this panel and with members in our IDF have also come out with explanatory materials and brochures for promotion of immunization in the country in the form of videos, booklets, and other ones. Over and above, I am proud of my fraternity because they have helped the Indian Embassy in providing the basic structure for telemedicine, which was probably not there before the COVID endemic, in providing community services in the language of their choice to the public, Indian as well as non-Indian in general. So I am thankful to my panelists, and this panel is open to all questions in this forum. Today we are going to cover essentially the newer aspects that are coming. When we completed the second seminar, we thought that we are probably at the end of the game. The end game is near. But this is a virus which is fooling us and making us, providing us new challenges at every time. So I am not trying to say that we are probably seeing the end game nearby, but like my colleague Dr. Saroj put in the first seminar, we are at least trying to tame the virus at the moment, to make it useful for us rather than a hard hit on our health issues. So let us start by discussing some of the, which are the most crucial issues in the management of COVID-19 in the face of the newer variants of concern that are coming, especially Omicron. Now, this session is essentially covered in 4 aspects. One would be dealing with the public health and the epidemiological aspects, which will be covered by my colleague, Dr. Arijit. We would also be discussing about the general presentation, clinical manifestations, and the best way of managing patients and the families with COVID-19. This will be done by my colleague, Dr. Alexander. Dr. Saroj Balagrover would be covering the aspects related to vaccines, whether the current vaccines are good enough to cover even the new variants, or do we have to go for new ones. And at the right extreme, we have Dr. Shanti Alexander, my colleague in pediatrics, who will be discussing with you with the new avenues about how to improve the management and care of children who are seem to be affected much more than the previous pandemics with the first virus as well as the Delta virus. So we start with the first question. These questions are essentially prepared by circulating amongst our colleagues and our members. So we start with Dr. Arijit. This question is to highlight what is happening from 2019 onwards. Since late 2019, the COVID-19 pandemic is continuing with the latest addition of the Omicron variant. Where are we now?
This is a very, very viable question which comes in everybody's mind. For the last 2 years, we have been witnessing the COVID-19 pandemic with its evolution of multiple variants, alpha, beta, delta, and the latest in the addition is Omicron. These are coming as waves of pandemic or new cases, and the last in the addition is Omicron, which is spreading so fast and so contagious manner world over, and now becoming the most dominant strain world over. It's really important for us to reflect on what's going to happen about this virus. It's surely that there are more new mutations and variations are likely to come up, which may be more or less serious. So we have to be prepared for that, and this is one of the important objectives of today's seminar, and I'm sure that the distinguished panel of experts present today would be able to reach a genuine conclusion towards the end of this webinar.
Thank you, Arijit. So, what is a prophecy? Is Omicron the end or still more mutations? Let me supplement this question with, the Omicron strain was detected on November 24th, 2021. Today is 22nd January. In 3 months, it has weathered a storm that is unparalleled. It is the dominant strain all over the world. Is it good or is it a bad sign?
Undoubtedly, when Omicron was first reported geographically from South Africa, and within a couple of days, World Health Organization mentioned that this is a variant of concern and variant of interest. See, when we call a strain a variant of concern and variant of interest, where there is a significant amount of changes happens to the virus, that changes the nature, the way probably it spreads, probably it can escape the detection by our immune system, probably it also changed the behavior of the virus, and that's what we have been noticing with Omicron. Now, what's interesting about Omicron, it's quite clear now to all of us that with Omicron, everything is very short. It has got a short incubation period, short period of illness, and short period of contagiousness. But unfortunately, in spite of having a short contagious period, it's spreading very fast, and it has already exceeded Delta being the predominant strain all over the world. That's a matter of concern, because unfortunately those who are vulnerable, those who are suffering from serious underlying medical illness, which my senior Dr. Varki Alexander is going to highlight, is definitely would like to suffer or likely to get affected and may develop those uneasy complications in the long run. But what can be postulated, at least the data which we are getting from UK, is that as it is spreading very fast, at the same time, possibly the pandemic of Omicron is also going to come down in a fast pace. So it has come faster, reached a peak quite fast, and very likely that it will pass off also in a very fast pace.
That's a good news, that we can hope that this pandemic with the new variant probably would end sooner than expected. But does this prophecy mean that there would be any change in the policies related to isolation or quarantine of those who have got infected and those who came into contact with a positive case compared to the previous variants?
We all know that the isolation and quarantine practices are specific practices in order to limit the spread of this virus, particularly if someone is been affected by the disease or somebody who came in contact with somebody who is positive with COVID-19. Now what's happening is that there is a recent modification which is in place in Kuwait and also in India, that those vaccinated individual, when we call vaccinated, means their vaccine status is up to date. For those individual people, those who came in contact with COVID-19 patients, the quarantine period is about 10 days. And if they remain asymptomatic and positive cases, and they are febrile largely during the course of their illness, then the isolation period will be for 7 days. Although the very recent data which are coming from the CDC USA, it's saying that there could be further reduction in the time provided for isolation and quarantine, provided those individuals are vaccinated and up to date in their status.
So, from all that what you said, can I say that the Omicron strain is less severe as compared to the previous two variants?
Yeah, what has been noticed so far, as we find that the number of positive cases both in Kuwait, in India, and also abroad like North America, we find that daily number of reported cases are quite high in number. Compared to that, the number of patients, those who require hospitalization, is comparatively less compared to the Delta variants. Now, we need to understand that right now, many parts of the world, the people have received vaccine and their body already can identify COVID antigen. Now, what is happening in case of Omicron, we have seen that this virus is able to fool our point of entry, that is in the nose. There, the local antibodies are not able to eliminate. So, people are catching the virus very fast, but the T cell, which has been trained, I simply call them as teacher cell in our immune system, they are the one who are able to identify and eliminate. That's why what's happening in Omicron is that those who probably not suffering from significant medical illnesses and also not, well vaccinated, they are unlikely to develop pneumonia or similar kind of more serious complication, which we have noticed in Delta and other previous variants.
Thanks for that clarification. Even though it is spreading fast, by all means, in medical parlance, the Omicron strain-induced disease is less severe, has a shorter course, and it has got lesser complications than those experienced in the previous two strains. One of the major concerns expressed by the medical community and the public in general is the detection of COVID disease in the presence of the new variants. For example, we know that we make a diagnosis based on the RT-PCR test. When the virus itself is mutating and changing its position, is RT-PCR still the gold standard for the diagnosis of an infection with COVID-19? Can the current RT-PCR testing diagnose all infected with Omicron and other variants that may come in future?
We know that RT-PCR is a nucleic acid based test. Basically, what it does is amplify a portion of the genetic fragment of the virus, and then through certain technique, we tend to identify that fragment, whether it's present or not. Now, what is happening with Omicron variant is that it has got a lot of mutations in its spike proteins. Now, what happens that most of the genetic laboratories from time to time, they are updating their PCR techniques. And we are currently in the 4th generation of RT-PCR, which is very likely to identify Omicron and also the previous variants of COVID-19 virus. Now, here I would like to highlight that RT-PCR can only tell you whether somebody is suffering from the disease or not. It won't be able to tell which variety or which variant the person is suffering, because that, in order to answer that, someone has to do something, we call it as a genetic analysis, and this can only be done in a virological dedicated laboratory and can be performed, like for example, if I would like to know how many patients admitted in the hospital suffering from Delta or Omicron, there has to be a sample survey, and in that sample, those who are positive for the COVID-19 can be analyzed genomic sequencing to identify which strain is the predominant strain in the community. But RT-PCR will not be able to discriminate between the subtype of COVID-19 virus an individual is suffering from.
And the question is whether we need to do such expensive, elaborate sequencing testing to identify a variant in our management?
This is possibly required or important from the research interest or scientific interest in order to know, particularly if we identify which strain or variants are likely to develop more complication, medical complications or significant consequences, or like pneumonia or so-called severe acute respiratory infection or syndrome, which we have noticed with the older variants. Thankfully, with Omicron strain, that potential and possibilities is quite minimal compared to the previous strains.
Thank you, Arijit. Now we'll move over to some of the queries related to the common problems faced in the medical management of cases with the Omicron variant. We are still hearing that most of the diseases that we know of is a one-time disease, but we are now hearing about patients who had pneumonia or mild symptomatic COVID infection, again reporting with another episode of COVID pneumonia or COVID illness. Dr. Alexander, what is the impact of prior COVID-19 infection on getting a second infection or a third infection with Omicron as a new variant?
Okay. Honorable Ambassador of India, respected President of IDF, and our Chief Coordinator, Professor P.S. Menon. Thank you for having me here. The question which is asked to me is pertinent. All of us know that COVID-19 infection, it gives certain amount of immunity, which is not long-lasting. With the Omicron variant infection, largely it evades the immunity which has been conferred by the previous COVID-19 infection. This is more relevant, more important, or significant in those patients who are not vaccinated. In vaccinated patients, if the infection comes again with the so-called worrying organism of Omicron, either the infection will be mild or it may be asymptomatic. This is the importance of repetition of infection.
Thanks for clarifying this entity, because which is of concern among most of the general public about that I may get a second infection. Why am I getting a second infection? One of the other issues related to medical management is that we are now advising several patients that you can be managed at home. So, may I ask you, what is your, as a medical professional dealing with a large number of Omicron and other associated COVID-19 disease in a public hospital in Kuwait, what is your advice to a patient and his or her family being treated at home?
Our hospitals cannot accommodate each and every patient with suspected Omicron or suspected COVID. We used to isolate and treat such patients at home. The important point is that an isolated patient is not a caged animal. He should be treated with all empathy and integrity and dignity. The most important points in the isolation of a patient at home are: he should be isolated in a separate room with good ventilation, and if possible there should be an independent toilet facility for the patient. Secondly, they should follow the instructions given by the healthcare worker or the health provider, so that in case of an emergency, he can contact, or other members in the house can contact and get the proper treatment. Third important point is that all household members of that house should wear mask properly. Fourthly, they should check the temperature and the oxygen saturation every 6 hours. This is a very important point for an isolated patient. They should avoid strenuous exercises. They should drink enough water, take plenty of vegetables, and a normal food. If any of the symptoms, like a troubled breathing, chest pain, persistent cough, or the saturation comes down below 93%, and persistently high fever, you will need the help of healthcare worker and maybe hospitalized. These are the steps which you have to keep in mind when you are isolating a patient at home. In short, these are the information which is to be given.
Suppose if the patient can have separate room but do not have the facility for oxygen saturation measurement, then what would be your advice? that they come if there is a problem, if they suspect a problem?
Well, in such situations, these patients may have a feeling of suffocation or they may have difficulty in breathing. This is the point which I wanted to tell. A troubled breathing,
Yes.
they should be hospitalized.
Yeah.
Another important point is that these patients should not be under the influence of somebody to take medications, whatever they need to take. The medications which they should take should be confined to simple medications like paracetamol or simple cough syrup.
Yes.
This is my advice.
Yeah, thank you for very clearly outlining what is meant by isolation. Isolation, as you rightly said, is not caging of a patient in the four walls of the house. It is careful, healthy management. But, Dr. Barki, Alexander, there is a group of patients with comorbidities, and what would be your special advice to those patients with a medical illness or a comorbidity, like for example diabetes mellitus, he has a chronic lung disease, or a chronic heart disease on management, or a patient who has or recovering from kidney failure? Such situations, what would be your advice?
My first advice is that none of such patients should never stop their regular medications. Unfortunately, some of the patients, either they are not understanding or they are not able to follow, they stop some of the medications. What I have commonly seen is that the diabetic medications, they will stop and they will follow with the COVID medications only. COVID medications means simple paracetamol or cough syrup.
Yes.
Likewise, other medications concerned with the kidney disease or heart disease. Patients with the significant comorbidities, like chronic kidney disease, heart disease, respiratory problems, or chronic liver disease, they will be hospitalized.
Yes.
Another important point is that these patients should be vaccinated.
Yes.
And these are the high-risk people who needs vaccination.
Yes.
In short, this is my suggestion.
Yes. Thank you. So you have said about one group of patients who needs hospitalization, those with an underlying comorbidity or an illness. Who are the others who needs hospitalization, and how do you manage a patient in a hospital situation?
Well, the high risk means the elderly people and patients with severe comorbidity. They are the patients who should be hospitalized. As I said just now, high risk means the patients with the chronic illness, respiratory, kidney problems, heart problems, or chronic diabetic patients, uncontrolled diabetes. They all should be considered as high-risk patients. Patients with a saturation, as I told before, with an oxygen saturation below 93%. Why I said 93? Because according to the AIEMS and ICMR recommendation, 93% is the cutoff value for a patient to be admitted at the hospital. Some other recommendations from WHO and CDC goes with 94%. So these are the people who needs special care and they are high-risk patients, they should be admitted to hospital.
What is the special management that would be needed? Just summarize that, sir.
Such patients, when they are admitted, there is a protocol for management.
Yes.
There is an internationally accepted protocol which is being modified to a little extent by each country according to their situations. We used to follow that protocol and give the treatment accordingly. Those patients who may need an ICU care will be identified early,
Yes.
and they will be shifted to the ICU accordingly.
One of the concern with the Omicron disease has been, are there any chances and what are the risk factors for deterioration in a patient who has developed disease due to Omicron? This worry is there because of the deterioration that we had seen with the Delta variant in the past.
The risk factors, the risk and the chances of deterioration of patients with the Omicron variant. The information is yet to be known. The reason simply being the identification of Omicron variants, it is not till now in different countries. It is not enough to say statistically the risk stratification.
Yes.
But in general, as I said just now, the high risk group of patients, again I am telling the chronic systemic disease patients like diabetic, respiratory disease, kidney disease, or heart disease patients, they have high chance and they are at risk of deterioration.
So that is very clearly you have highlighted the importance of identifying those who are at high risk and those who needs to be hospitalized. Whereas in general, a large number of patients can be managed with the home isolated care if diagnosed early and in time.
That's right.
Thank you, Dr. K. Alexander. Now we are going to the section on vaccinology, vaccinations and how it is doing the current strategies with the Omicron variant. Dr. Saroj Grover, we understand that the vaccine is helping patients to combat COVID illness in general and also helps to decrease the hospitalization as well as the admission to the intensive care units. What are the concerns now with the Omicron variant?
Right. Thank you very much for, sorry.
It's on.
Hello. Yeah. Thank you very much for inviting me to be part of this forum. Coming to your question, yes. I remember that, when we talked about vaccines, we were so happy that, the vaccines are doing what you said. Yes, we know that, the vaccines, if a person is vaccinated, the person will get, if he gets infection, it will be a mild infection. He will not end up in hospital or in ICU or no deaths. We are very happy about that. It's not that we are not happy, we are even happy now. But there are certain concerns. One of the concerns is, the breakthrough infection. Now, what is this breakthrough infection? As Dr. Alex already mentioned, breakthrough infection means even those who are vaccinated, even those who had, COVID before, so they will get infection again. And this is so true with Omicron. Omicron is known to cause infection in the vaccinated, even those, people who had COVID before. That's our concern. Yes. And second concern would be, boosters. Now, we want a vaccine, where we will take the shot annually and not have, booster every 3 months, booster every 6 months, booster every 9 months. So what am I trying to say? So what I'm trying to say is we want a vaccine which is 100% efficient. Let me give you one example. The smallpox vaccine. This is a success story of a vaccine. With smallpox vaccine, the world has been got rid of smallpox. Another success story is polio. So this is our concern. And hopefully, someday we will have a vaccine which is 100% efficient, and we will be needing booster, but not every 6 months or 9 months, every 1 year or 2 years like that. Thank you.
Thank you. There is hope at the horizon. What you have said is very illuminating, and it is very happy to know that vaccination is a major tool in the management of COVID and not just prevention, in the long run especially.
Right.
But the biggest problem is vaccine hesitancy. It's a big barrier to the vaccination strategy now. So, may I ask you, what do you mean by vaccine hesitancy? And what are the major reasons for this?
As you mentioned, vaccine hesitancy is a big problem. Now, what do we mean by vaccine hesitancy? It means that, either the people, they don't want to take the vaccine at all, or maybe delay in taking the vaccine. And coming to your next question,
what are the major reasons for them?
Yeah, what are the major reasons for vaccine hesitancy? 3 major reasons that I can think of is, the vaccine was made in the people think, the vaccine was made in a big hurry. So they are not confident with it. They don't think that it is an efficient vaccine. They think that maybe it will have side effects, maybe the immediate side effects or the long-term side effects. If you would remember, people were very concerned. When Pfizer vaccine came, it is an mRNA vaccine. So not knowing the difference between an mRNA vaccine and a DNA vaccine, people were paranoid. How can I take a vaccine? It's it will change my DNA. Things like that, which is the reason for vaccine hesitancy.
So obviously the question would be, we need to work a lot to manage this problem of vaccine hesitancy.
Right.
So tell us, with your experience, how do we deal with the vaccine hesitancy problem in the public?
Right. Before that, I will like to mention to you about a very interesting study. I would call it a very pioneer study, which is done in Kuwait. So this was published in July last year. It's a very pioneer study. It is a cross-sectional study, where they try to, identify the main reasons for vaccine hesitancy. They also identified the group. So let me tell you a little bit about this study. So this was a cross-sectional study where they took about, 4,000 participants. Now, the results were 80% of the people, they said they will take vaccine, or, they have already taken vaccine. 20% of the people were vaccine hesitant. And what are the reasons that they find, which I mentioned before? They, again, very worried. They don't want to take a vaccine which was made in such a hurry. They were worried about the side effects. And they said, the vaccine will not be efficient. Now, the other parameter which they found was the group. They identified the group. Which were these groups? This group were, the young people, or, between the age of, not so young, 30 to 60 years, females, those people who were coming from, for the middle socio-economic group. They were not highly educated. Now, what I found interesting in this study, which is quite relevant to us, was, when they were asked, about whether they took the flu vaccine, they did not take the flu vaccine, before. Now, this shows that, these people had apparently, a little disregard for vaccine. Because when they were offered other vaccine also, like the pneumococcal vaccine, they didn't want to take. So, and also, sometimes people have that attitude, kuch nahi hota. Like that nothing is going to happen to them. And that was identified in that group. These people, some of the people, unfortunately, they were so, I would say, did not worry or did not think that they did not know even, if they had a COVID positive person at home or anybody died of COVID. And they also indicated that, very confidently that neither the family members or the friends will take the vaccine. So these are the, parameters or the groups that we need to work out. I would very, and there are studies around the world, they have found similar findings. But I would say that, Kuwait has done a wonderful job. 75% of the Kuwait population has got, both vaccination, and 7.2% had received booster.
No, I think your study as well as your explanation points out that there are certain high-risk groups who actually avoid vaccination, and I think probably we have to work towards educating them and bringing them to the vaccination campaign. So we have to work towards that.
Exactly.
Yes.
So, your question, how to deal with it.
Yep.
So, putting all this factor into mind, the three things that we should take care of is, one should have mass media campaigns by the public health authorities, and involvement of the medical personnel. Now, this is exactly what we did. So you would ask me, when I say we, what do I mean by we? By we, I mean, the Indian Doctor Forum with the Indian Embassy under the leadership of our ambassador, Mr. C.B. George. You have already highlighted them, so I will just quickly go through them. So we had, 3 webinars, and of course, the release of the COVID-19 health guide. Here I just want to mention, in that health guide, we had a special or a very separate section on vaccination, where we talked everything about vaccination, how it was made so quickly, why it was made so quickly, the vaccine platform, the side effects, different vaccine, their efficacy, who should take, who should not take, and we also gave guidance for the vaccinated and unvaccinated people. And to recap what you said, we had a book on vaccination, we had videos, and also we had teleconsultation and messages. But one interesting thing that I found was, to reach across people, in other countries they are finding, they are trying to produce a vaccine, the combination vaccine, where, you have the flu vaccine and the COVID vaccine together. But, I mean, it is a long way away, but it could be very helpful that people, when they come for the flu vaccine, we can offer them the COVID vaccine. Lastly, in the present era, I would say, vaccine hesitancy.
One of the problems that we have seen with the vaccination drives throughout the world is the inequality of vaccination. What is the need of the hour to achieve vaccine equality or vaccine equity globally?
Right.
And what is its effect essentially on vaccine hesitancy? Yes.
Okay. So, the first question,
yes,
what is vaccine equity? Now, what does vaccine equity means that, vaccine equity means that, the vaccination should be available to all nations, disregard of their social status. Now, this is based on the thinking that every individual has the right for maximum health. It doesn't matter, what the social status is. So that is vaccine
Yeah, we have to
equity,
ensure the right to health.
right to health. That's
Yes.
right. And your next question, how does it affect vaccine hesitancy?
Yes.
Directly. See, I will give you example of countries, who are not, where the population is not vaccinated.
Yes.
Now people have started to say, why should I get the vaccine now? I have survived, all these years, without a vaccine, and I am doing quite well. So there's no need for me to take the vaccine.
So how do we go about to overcome this vaccine equity and implement an effective vaccination program?
So this, I mean, the whole world is working at it. So it should be done at an international level, and also I would say at the governmental level or a national level. So at the international level, we had the COVAX program, where the vaccines are being supplied to the countries which need the vaccine. At the national level or at the governmental level, I would say that the government should well receive it, distribute it well, but that's not all. They should make sure, that every person gets the vaccine.
I would like
And-
to
sorry?
add to this that the government of India has been in the forefront of, as our ambassador C.B. George highlighted, in the forefront of
Yes.
providing vaccines to the needy countries, even supplying to almost all around the world vaccines. I think that would go a long way in providing vaccine
You see,
equity
Doctor, yeah.
and avoiding vaccine hesitancy.
A very interesting thing which I read was, you see, it is sometimes it is not enough to apply, supply vaccines. One suggestion would be that the governments, they can implement,
Yes.
or amalgate it with their other national program. Like, countries have national TB program, they have national HIV program. When the people come, for screening for HIV, they come screening for TB, or they come to collect the TB medication or HIV medication, maybe that is the time, one can talk to them, and offer the vaccine to them. What I feel is, that COVID-19 vaccine should not stand alone. It should be, a part and parcel of
entire-
other things.
Thank you for clearing this aspect very nicely. One of the major queries related to the vaccination drives in public is about booster vaccination. There is a lot of misconceptions about booster vaccination. Now, before we go to booster, is there any change in the definition of those who are fully vaccinated?
Okay, Dr. Menon, when we are talking about vaccine equity or vaccine hesitancy, I would like to mention one thing. What is the need of the hour? Why do we need to do this? Because because it is so important. If we didn't do this, what will happen? If people don't get vaccine, right, more and more people are going to get, serious illnesses, or, they are going to be sick more. So this is going to be a burden in the community and in the government. Second factor would be, which, I really care for, we want a herd immunity. And we will be, why do we need a herd immunity? As you said before, that, when we create herd immunity, it is like taming the virus, that is to end the pandemic, and, the virus to become, epidemic and not pandemic anymore. We need to do that. And third is emergence of mutants. Now, mutants are the bad effect, you can say, or the side effect, you can say, of, vaccine non-equity, I would say, and vaccine hesitancy. So these are really important elements that we need to take into account.
Yes. So coming back to boosters, is there any change in the definition of fully vaccinated?
As far as the term fully vaccinated goes, it is the same.
Yes.
Meaning, the people are considered fully vaccinated if they have taken their 2 doses of the vaccine If it is a one dose series, one dose, and they are term fully vaccinated 15 days after the second dose. But CDC has, introduced another term, which is called up to date. Now, what do I mean by up to date? Up to date means that you take your primary, vaccination, the first and the second dose, right? And then you have to take a booster. So unless you have taken a booster, if you qualify for it, okay? And if you have taken your first dose, you have taken your second dose and a booster, then they will, say that you are up to date with your vaccine. And Kuwait has already, saying that. But they are not using the term up to date, but they are saying that you are not fully vaccinated if 9 months have passed after your second dose. So very soon, I feel that, instead of using the term fully vaccinated, we would be using the term up to date.
So what is a booster, according to you?
According to me or according to the world?
Yes.
So booster means, like the word says, boost, okay? Yeah. So we know that, after the 2 doses of the vaccination, yes, our immunity wanes or it comes down, right? So we need to improve this immunity. To improve this immunity, or to say to top up this immunity, we need booster. Yes. And these are especially more important now, as we mentioned before, Dr. Varki did and I did, because of Omicron, the new virus that the new mutant that we have, because it causes reinfection, yes, even in the vaccinated and those who have the disease before. Yeah. So this is booster.
Oh, yeah. So is there a difference between a booster and a third dose?
Yes.
Maybe a little difficult question.
No, because this terminology we need to get used to, because we say third dose, we say booster. As far as booster is concerned or a third dose is concerned, it is an additional dose we are giving, but the terminology is different. Let me explain how. So when we say a third dose, we know that, certain population, let me give the example, those who are immunocompromised. Now, these people are more prone to infections, more prone to severe infection, I would say, to hospitalization and death. They are in the priority list to get the vaccination. They have taken their first and second dose. But now we know that, the immunity which they get may not be enough. So they need a third dose. Now, what do I mean by the third dose? This applies to the people who have not started their primary series, meaning they have not taken the vaccination at all. So you will give a first dose, you will give a second dose, and then you will give a third dose. This third dose will be after 2 months of the second dose. And this is called, primary third dose series, right? But this you can only do with the people who have not started the vaccine process. If they have already started, they took their vaccine maybe say 6-7 months before, they will be given a third dose, but in that situation it is called a booster. No, not only that, for the severely immunocompromised people, they are offering a fourth dose, not a booster. So this fourth dose will be 3 months after the third dose. Now, which are the people, who should be getting this third dose? As I said, the immunocompromised people. So these are the organ transplant recipients, those immunodeficiency, people who have immunodeficiency like HIV. Yeah. These are the people, who would be needing this. Yeah. Right.
So you have clarified my question about a booster, third dose, and third dose primary series.
Confusing, isn't it?
Confusing terms. I think we should actually probably go to the CDC and use only the up-to-date term, probably for clarification.
Dr. Menon, unfortunately, we need to we need to get used to this terminology because
Yeah.
very soon there will be nothing like, fully vaccination. They would be asking, America is already asking,
Yes.
USA, are you up to date with your vaccine?
Vaccine.
And also, the primary
Yes.
3-dose series
Yes.
and 4 series.
So, little more questions on booster from the public. Who should take a booster?
Exactly, this is what people want to know. So I would say, that all of us,
Yes.
who have already taken the first
You
dose.
mean all healthcare professionals?
No, not health. When I say all of us, he thinks of only doctors. Huh?
Yeah.
I mean to say, people who have already taken the first dose and the second dose, okay,
Yes.
the primary series,
Yes.
and about the age of 12.
Yes.
Right. And then, now the immunocompromised people, but they have already taken booster before. When I say immunocompromised people, I mean to bring in, the children
Yeah.
between the age of 5 to 11. In other countries, they are not being vaccinated, but in other countries, they are. So this is the population that needs to have a booster.
The second question related to booster is the choice of the vaccine for the booster. Should we take a different vaccine? Because maybe different vaccine can give stimulus to immunity in different ways. Is a mix and match allowed?
Mix and match, yeah, this is such a popular term. So mix and match, again, for the primary series, meaning, if you have taken the first dose and the second dose, it should be the same vaccine.
Same.
As far as possible, don't mix and match for your primary series. But CDC has now, recommended, or there is a recommendation that you can mix and match with the booster. Now, this is called heterologous. But if the same vaccine is given, this is homologous. Now, in India, what they are doing, it is homologous, meaning those people who had taken, Covishield
Yes.
for the 2 doses.
AstraZeneca. AstraZeneca vaccine.
Right, that's,
Yes.
but in India it is Covishield, right?
Yes.
So the third dose will be Covishield.
Yes.
Yeah? And this is offered to people above 50 years of age and healthcare personnel. So still it is a homologous series, but very soon it may become heterologous, yes.
Yes. What is the recommended interval between a primary and booster dose?
The first, okay. So this is sort of different in different countries.
Yes.
Let me say Kuwait first. In Kuwait, it is, after the booster should be given after 6 months. But the recommendation is also there if the person is immunocompromised or he has too many, comorbidities, then maybe the booster can be given earlier. But the recommendation is for 6 months. In India is, 9 months after your second dose. In UK, it is after 3 months.
Yeah.
And in States, for the Pfizer vaccine, for the mRNA vaccine, Pfizer and Moderna, it is after 6 months. And for J&J, it is 2 months. So
that
each country has
a
different
each vaccine has a different one. The other question is it recommended to take a 4th dose as booster? You mentioned about it in a parting way, but I thought it is not very clear.
Yeah, so that 4th dose is different that
Yes.
we talked about,
Yes.
but 4th booster,
Yes.
4th-dose booster, let's put it that way.
Yeah.
It is not recommended, there's no recommendation for that yet because we still do not have enough data about the 3rd dose booster. But there are some countries, who have thinking of giving the 4th-dose booster. Some countries have started also. So they are giving to their older population or to the healthcare personnel or to people who are at high risk. But for us, no, we continue with our 3-dose booster.
Thank you, Dr. Saroj, for answering so many questions on a very important topic on vaccinations in the COVID season. Yes. One of the other problems that we have seen is, which Dr. Berke Alexander very rightly pointed out, was the involvement of high-risk populations with COVID-19 disease with the new mutant Omicron. And one of the major groups that has been largely involved are the children. those below 18 years, those below 12 years have been significantly involved in large numbers compared to the previous pandemics with other variants. We have Dr. Shanti Alexander, consultant pediatrician, to answer us some of our queries related to pediatric disease with COVID and especially Omicron disease. Dr. Shanti, the main question is, what are the common ways that children are presenting with COVID-19 infection, especially with the new variants? Are they similar to what is seen in adults?
This time around, we are seeing a large number of children are being affected by COVID, presumably the Omicron variant. There are two reasons for this. One, it would be because the Omicron is highly contagious, so it's spreading rapidly in the community, including the homes. Yes. Number two, in the previous waves, there was a lot of social restriction. Schools were closed, outdoor entertainment, everything was closed, people were restricted to homes. So the children were also at home. Yeah. So the exposure was much less. Yeah. So this is one reason why in the current wave, a higher percentage of children have been affected compared to the previous waves. Secondly, as you asked, we are seeing a lot of children affected by Omicron variant, but the good thing is that around half of them at least are completely asymptomatic, and they are being found only when they are being investigated or checked as a routine when they are being admitted to the hospital for some other illness, or when a family member is affected and all the contacts are being tested. The majority of the children whom we are seeing in the hospital may be just having fever, or may just have some sore throat, mild cough, or maybe very few patients having chest infection. Some of them may be having vomiting and diarrhea, and this is the reason for admission. But on the whole, what we are seeing in this wave is a very mild affection of the children.
It is reassuring that probably the number of children, even though involvement is high, the involvement with severe pneumonia or requirement for IC intensive care admission is much less.
Yes.
Much less compared to those who require such care for other illnesses.
Yes.
Yes. What would be your advice to the parents if a child is infected with COVID-19, especially with the Omicron variant?
I think the first and foremost thing is to find out how is the child. Yes. If the child is well and is able to feed and drink and is passing enough urine, I would say the child's intake is enough. Child is well. If the child doesn't have any other problem, doesn't feel excessively tired, there is no breathing difficulty, the child is comfortable otherwise in between the fever, we can wait and watch at home. Yes. I would alert the parents that in case the child is not able to drink or eat enough, or the child is excessively tired, or has something that is worrying like a convulsion, or child is not looking good, the parents are not happy, or the breathing is fast, or I would say fever is persisting more than 5 days, then please seek medical help.
I think it should be parents' perception how whether the child is sick comes here much more than anything else, because the child himself or herself may not be able to tell, especially a young child below the age of 3 years. It is very parental perception is why important. And I think parents' advice has to be counseled properly regarding that.
Yes, if a parent ever has a doubt, my child is not well, I think it's always better to come and have a checkup at the hospital. Yes. And be reassured if the child is well and go home.
Yeah. Dr. Varki Alexander said about the high-risk group among adults who are likely to get a severe COVID-19 infections and requiring ICU. Are there such groups among children, those who are of high-risk group, likely to get a likely to get a more severe form of disease? Can we identify them?
Yes, in pediatrics also, we have high-risk categories. Yes. One group is especially the ones who are less than 1 year, especially those babies who had been born early or had other problems during their time soon after birth. The other would be babies who have some genetic problems or like Down syndrome, who are bedridden, who have problems affecting their lungs or heart or kidney. They have other underlying problem which make them high risk. Besides this, common to the adults, we also have a lot of children with severe asthma, with obesity, with diabetes, either type 1 or type 2, or immunodeficiency. Actually, obesity is a problem among all the communities in Kuwait, and we have seen that this group is actually having higher risk.
Thank you for highlighting this. You just heard my colleague Dr. Saral Balagrover talking about vaccination, and we were too considering adults. Now, routine vaccination is accepted among children. Many categories of children have been included in the routine vaccination programs against COVID-19. Can you just elaborate what are the strategies now, which age groups are being given vaccination, and are children being missed in these programs, and what should we do?
Here we, as we know, we started with initially vaccination for the adults,
Yes.
and it has come down till now. From 5 years onwards, the children are being given vaccination.
Yes.
All children above 12 years are eligible for booster.
Yes.
Children with immunodeficiency, at whatever the age group, are being given a primary series of 3 doses and a booster subsequently. During the 2 years that there was a lot of lockdown and restriction, a lot of children missed their normal routine vaccination.
Yes.
Which I mean by DPT vaccine or the influenza vaccine, the normal vaccination of children. And so I would advise that whoever missed should seek their medical attention to catch up with the vaccines that have been missed. These can be taken, 2 or more vaccines can be taken at the same time, along with the COVID vaccine or at separate intervals, but they need to be caught up.
I think we have to reassure the parents that it is safe to take vaccinations, the normal national vaccination schedules, along with COVID-19 vaccinations. There need not be a fear complex about that.
Yes, actually we are advising to take 2 or more vaccines at the same time because all said and done, these vaccinations, routine vaccinations, are responsible for causing preventable diseases.
Yes.
So they would protect the children.
Yes. Thank you for clearing that doubt about combining or completing the normal vaccination schedules for children. One of the major problems that has been observed by pediatricians in general and published worldwide is the element of stress that has come and manifesting in different forms with the onset of the COVID-19 disease, especially the Omicron. So children are also at different levels of stress due to various restrictions and also various routines that has to be followed during the COVID-19 pandemic. Their normal play, activities, schooling, all are restricted. How do you help a child, as a child specialist, cope with the stress of COVID disease in their day-to-day activities?
Actually, like adults, all the children are also facing stress. Probably we tend to overlook this fact because they may not express. But as parents, we all need to keep an eye on our children, whatever their age group are. Smaller children may just be irritable or cry or maybe sad or maybe withdrawn. Some children, especially the bigger ones, may act out, become aggressive, either towards other family members. Some of them will prefer to just sleep a long time in having a disturbed sleep cycle, disturbed patterns of eating too much, eating less. It is up to us as parents to, listen to the child, try to get the child to express their feelings. Because when the children express their feelings to us, we are able to address them. We as parents should address them and reassure them that this pandemic is not a permanent one. There is going to be an end. And we as a family should fight it out. And we will become resilient in this process. So when we as parents are able to deal with this situation very calmly and confidently, And the children look at us, and I think this example we set would be the best one. We can also practically, I would say, don't listen to news too much. Just follow the news for a couple of...
News means
news
media.
means from the TV, news means from the social media. A lot of negative news is going around,
Yes.
and it's sort of echoing on each other. So we can just restrict our the news that we listen to as a family, decrease the negative talk that we have or the problems that somebody else is facing, and we encourage everybody to be positive, because we'll have a positive outcome when we ourselves are confident. In the meantime, children need to have a structured routine. And this is very important because they feel safe in this routine. By this I mean, even if their children are at home, either if they are under home isolation or otherwise, let them have a fixed routine of getting up on time, having the meals together on time, having to do their daily studies if they have during that period, and also definitely having periods of fun. During the lockdown periods, the fun periods were restricted to home, and we had to entertain the children with board games, some new hobbies, drawing, etc., what could be done at home. But now we don't have that restriction. So now we can go out, but we have to choose our entertainment wisely, by which I mean let's go out to outdoor, open areas, where with social distancing being maintained and proper mask use being maintained, or we will provide the entertainment and at the same time be safe. So this way of planning the child's life and routine would help them to cope up with the stress. But definitely, I would say a small percentage of children still may feel upset, and they may need further care, by which I mean they may need professional counseling and help.
One of the groups that I found was, maybe your experience too, children also see what is happening in the families of their friends. There may be a loss of a beloved member of one of their friends, colleagues, and that also upsets. So sometimes a seemingly innocuous or unaffected child also needs to be counseled properly, and I think parents should not take it lightly, and attention should be given and advice should be given.
Yes. This is what I think during the previous wave, when any child would lose a parent, the whole school would be informed, and this was stressful for all the children, and they are coming home and talking with us. Yes.
So I think there should be a professional way of handling such emergencies or adverse outcomes of disease in somebody's family related to the children.
Yes.
So that comes me back to the question of schools. We are back to school. Schools have opened either completely or partially. What should be your advice as a pediatrician to the parents who send these children to the schools, to the teachers who are teaching them and taking care of them in the school, and the school administration in general?
Physical classes actually have provide the children with lot of structure, and they can never be substituted by online learning. So where possible, physical class school attendance is the best. But keeping in mind, including Kuwait, most of the schools give that option, or final decision in the hands of the parents, because one, maybe they have somebody who is high risk at home, including children below 5 years who have not been vaccinated, or the children per se themselves may be high risk. So the decision of how to attend the school should be left to the parents. The school per se can facilitate good attendance without any increased risk by social distancing. By this, now the CDC recommends 3-foot distance between the children. If this is not possible, by following the other strategies, like ensuring good ventilation. When we open the windows and doors of the class, or for example, we have ACs, we can get the fan to run 2 hours before, during the entire school time, and 2 hours later, the air is filtered. Like this. And we're ensuring the children are using the mask correctly and consistently during the whole period. This one, and encouraging them to do hand washing with soap and water, and if not, during the class time itself, by frequent use of 60% alcohol hand rubs. Also, we can, the school authorities should clean the entire premises of the class once the school is over and keep it ready for the next day. All the teachers and other non-teaching staff at the school should be fully vaccinated. And all children also, because vaccination is being provided, should be vaccinated, except if there is a specific contraindication. We would also be clear that all the parents should be aware that if their child is sick, don't send the child to school. If one of the parents have been exposed or are positive, keep their child at home. Because if everybody decides to do this, then the whole class and the school will be safe. And they can continue their classes online. So there is no penalization.
What is the current recommendation if a parent or a child is sick? How many days off from the school?
As per our guidelines that we are following in Kuwait, once there is a contact, we advise them to keep them at home for home isolation 10 days.
10 days.
10 days.
Yes. So you have covered, I think all the things that you have said about the parents and the teachers are also applicable to the non-teaching staff of the school, which includes all workers in the school.
Yes.
It's also equally applicable to them. So nicely explained. Thank you, Dr. Shanti. Now, we are also parents, as we are also, in addition to being healthcare professionals. How we as parents can help our children to make the best out of the present situation?
I think to have a positive attitude,
Yes.
this is the most important thing, and to have trust and faith that this is going to end. We have to fight it out, and at the end of it, we are going to come out stronger. This is very important.
Yes.
To be a good role model in the house in dealing with this crisis is very important.
Yes.
And I think in a simple way, to count all the good things that are going on well in our life, to count 1, 2, 3, what good things are going on, to have an attitude of gratitude. This is very important.
Thank you, Dr. Shanti. I think you have very lucidly covered all aspects of child care management. It is not just patient care management, child as a whole being managed in the scenario of the new epidemic that is happening. We have covered the high-risk situations, but now we are opening out for the public with some of the questions that we have received. We start with one. Dr. Varki Alexander, we will start with many of us, both in the medical profession as well as in the non-medical profession, are keen to know, are there any rapid advances in the management of COVID-19 disease in the form of some cure? We are all looking for it. Is there something available now?
Well, this is an interesting question. The rapid researches are going on in different parts of the world, including India. To our relief, to say some good news that some of the medications are on the way, and they are still under the microscope. I mean, they are still under the trial phase. Hope these medicines can reach us without much delay. As far as I know, it is now available in some of the Western countries only, not yet reached to our places. The researchers, they made these medications with side effects. So one important thing is that none of these medicines are not substitutes for vaccination. These are not to be used as preventive medications. And another important point is that these medications are used for treatment of mild and moderate diseases. FDA has given an approval, it's a distress approval in fact. FDA is the higher drug authority in United States, which is accepted all over the world. And they have specifically said these medicines are not substitutes for preventive purposes. Vaccination, no doubt. And these medicines are only for mild and moderate illnesses, and that too in the trial phase. This is the information.
Thank you. I think this is very interesting and very informative that at least some new medications, curative forms are on the horizon at the moment. Let us hope more and more things will emerge. Dr. Arijit, you started with the public health and the epidemiology. My question to you and from the public is, in addition to vaccination, what additional steps are required to combat COVID-19? Or just vaccination is good enough?
We are what we are witnessing right now with the rapid spread of Omicron variant of COVID-19, that everywhere, all over the world, more and more in quantities, cases are being reported. Thankfully, the number of serious cases are less, but at the same time, as my senior Dr. Varki Alexander has highlighted, that people, those who are at high risk, those who are inadequately vaccinated, are still liable to deteriorate and require hospitalization. But the good news is that we are better prepared. We have more percentage of people who actually has received vaccine. We have better facilities, healthcare facilities, both in India, in Kuwait, and all over the world. We know the disease, we know the character. We have been battling with this pandemic for last 2 years. There are protocol-based treatment, as Dr. Varki was mentioned, for admitted patients. So we know, depending on the stage of presentation and serious situations, how to deal with. But at the same time, there are certain things which need caution. Because Omicron is spreading quite fast, we know that it's also affecting healthcare workers. At a given point of time, we come across that many of our friends, our colleagues, the doctors, nurses, paramedical workers, they are getting positives almost simultaneously, and that might cause a tremendous amount of strain, because in order to run the infrastructure, in order to run those machines, we need the manpower, we need the health personnel. So that's very important. And here comes to follow the public health and safety measures. We should all follow the guidelines which has been published time to time from the health authorities. We should wear masks in a crowded places. We follow those significant pillars which we have been insisting right from our first webinar, the 3 pillars: social distancing, sanitization, wearing mask, and at the same time ensure that we are safe, our family is safe, our community is safe, so that we can safeguard everybody besides effective vaccination strategy.
Thank you, Arijit, for highlighting the issue of the Omicron variant, especially affecting the large number. I think it is all over the world, it is currently seen. We also see many reports from India, major hospitals reporting higher number of healthcare professionals being affected with the disease. So we also have to learn, our community also has to learn to take care and hold health precautions. So my question to Dr. Saroj Grover is, we spoke about the disease detection, disease management, prevention, and you said a lot about vaccination. Now that you have seen 2 years of COVID-19 disease with pandemics, with new mutants, what is your perspective on the world getting vaccinated and getting the disease over. Is that probably the ultimate end of this disease?
So I would call it a COVID-19 journey.
Yes.
It is a journey. I still remember, when it hit us, the virus hit us, we didn't know anything about the virus. We didn't know anything about how it spread. We didn't know the signs and symptoms. We didn't know the treatment. We didn't know anything. I still remember, standing helplessly, when our patients were deteriorating. We didn't know what to do. But we are more clever now, I would say. We know much more about the virus. We know the signs and symptoms. We know the complication. We know the treatment. We know the management. Having said that, the most important thing is we have a very, important weapon, and that is vaccination. I don't know how many times I'm going to say it. I said it in my first, webinar, taming of the virus. I hope I say it the last time. What do I mean by taming of the virus? By producing herd immunity in the world, we want to end the pandemic. That is what our aim is. And we are almost there. I say, there is a big windy, channel. It was long before, but as Dr. Grover mentioned, one time, it is becoming shorter now. And I want to end on a very positive note, Dr. Menon. Yes. So please, hang on. Yes. We will have probably a new life. Maybe we will have a new life. Maybe a little bit more modified, but we'll come back to our, original way of living. Yes. So I would just say, hang on. Everything will be well.
Thank you, Dr. Saroj. Dr. Shanti, do you share this optimism of my colleague?
Yes, I am an optimistic person, and I definitely feel that we will reach the end of the epidemic. And I think the most important thing as adults is to get ourselves vaccinated, to follow social distancing as it can be practiced in our circumstances, and to correctly and consistently use the mask. It's the most simple thing that we often don't follow. Yes. I think by this way we can keep ourselves and our children safe.
Thank you. I would give the perspective, the last word, to the person who sees probably the largest number of COVID population in this particular group, Dr. Varki Alexander. What is your perspective on the current epidemic? It is going to end soon. Is a new mutant on the run?
Yeah, Professor Menon is asked me a question which is practically difficult for me to give a correct answer. But as Dr. Shanti was telling, I am an optimistic person. I too is an optimistic person, and I hope this pandemic will end soon, as it is showing some markers to shifting it to an epidemic rather than a pandemic.
I hope we are all sharing this optimism. Now we are taking some more questions from the audience. One of the questions are related to the testing for COVID-19 disease in the general. Mr. Iqbal is asking, are there different types of results when an RT-PCR is done, other than positive and negative? Dr. Arjit?
Yeah, actually, this is a little bit theoretical in nature, yes. But still I will take up this question just to make, in a very layman's term, what RT-PCR is done is basically you take the fragment or the genetic fragment of the virus and then you keep on multiplying, right? So, for example, if you take a cycle of 5 minutes and if you multiply 30 times, that means in 150 minutes you will get some 30 billion copies of the virus. Now, some of the lab, they might give you some sort of positivity or titer, because if the load of the virus is more, then even in earlier stage of multiplications, you will get the positivity. For example, you don't have to wait for 30 times. Maybe after 15 times you get the positivity. That's why, again, I must say that this is called RT-PCR. You know, this is real-time PCR, not the conventional PCR. In conventional PCR, the data is recorded at the end of the study, whereas in real time, the machine, because of the fluorescence, it will automatically say there is a detection. So if 15 cycle, after that if you check, yes, there is positivity. So you don't have to wait for 30 times. So some of the laboratory might say that this, but again, at the end of the day, the data is whether it's positive or negative, because there is a sufficient period of time given for the sample in the panel to multiply enormous quantity to distinctly say whether that content, provided it has been done in a proper manner, has the suspected virus or not. Obviously, there are three things is to be perfect. One, proper collection of the sample, proper transportation of the sample, and interpretation and analysis of the sample in a well-validated lab. You know, that's why many times, you know, Kuwait authority ask for a well-validated lab with QR coding to make sure that the data is reliable and reproducible.
Thank you for clarifying that. The next question is by Dr. Sridhar. Many people probably suffered a disease from COVID-19 without undergoing or confirming with a PCR. How to advise them about booster dose vaccination? Dr. Saroj? A person probably has suffered with a COVID disease, but there is no confirmatory test available to prove that he has suffered. Should he receive vaccination as normal, or should he wait over a period of time?
He does qualify for, sorry, I almost forget. He does qualify for a booster. It is immaterial, you know, whether he had COVID infection or he had any other infection. So he will take his booster according to his scheduled time. Whenever it is due, he will take it. Yes. But he does qualify for a booster.
Dr. Varki Alexander, if a person has suffered from COVID disease, if the person has suffered from COVID disease, either proven or not proven, and he has to take vaccination, what is the disease-free interval that the person should be taken, advised for vaccination, whether it is primary or whether it is secondary?
Yeah. Till the time the information available to us is, the interval is 90 days, 90 days. Once the patient had a COVID infection, if he wants to take a vaccination, whether it is primary or his continuance of the booster or the third dose, whatever it is, the time interval is 90 days, 3 months.
Yes. I think that is very clear answer. Another question related to vaccination. This is by Chinmaya. For those who have received vaccination with AstraZeneca or the Oxford vaccine, primary 2 doses, is the booster being given is that of Pfizer? Is it okay, or are there any guidelines to this vaccination? This has come because of the mix and match question that has come.
So it is quite okay to take Pfizer.
Yeah.
There is no contraindication that he cannot take Pfizer. So it is from country to countries. As I mentioned, you see, in India, they are doing the homologous series. So the third dose is the same as the first and the second dose. But there is no contraindication that he cannot take Pfizer if he has taken, any other vaccine before.
Yes.
Mix and matching is allowed. Yes. And this is called the heterologous series.
Yes. Another question is, are self-home test kits are available in pharmacies in Kuwait or in India?
It is available.
They are available.
In Kuwait, they are very easily available. And maybe one reason why, the numbers we are getting are less is because now in India it is available also that people are, using these kits at home, and if they are positive, they don't want to say that they are positive, and they are not counted.
Yes. Another question from Mubarak Kamrat. There are few of us who got infected twice or once in 2020, another one in 2021 by Delta, taken 2 doses of vaccine, still facing a lot of post-COVID issues. Do we have to go to periodic checkups? For those who have got infected twice and 2 doses of vaccine, do you advise booster or necessary for this? Dr. Varki Alexander. This is post-COVID scene.
Of course, there is an entity called long COVID syndrome.
Yes.
I think in the same platform, I have participated in one of the sessions of long COVID. The effects of the long COVID, it may last for several months. If the person develops another infection in between, again it will be further prolonged. There are a lot of syndromes of long COVID, which is varying from extreme fatigue to confusion, affecting different systems. Usually these are self-limiting conditions which will take its own time. Usually this does not need any active treatment. One of the common conditions is postural tachycardia syndrome, where the person will feel palpitation, increased heart beating when they stand up. Lying down is better. With the simple medications like beta blockers, this will become okay. No need for any aggressive treatment in such cases. Another is the brain fog syndrome or gray brain syndrome, something like that. These are all with the time weaning off syndromes, diseases. Does not need any active treatment. This particular person who raised this question can be reassured with the supportive care only.
Thank you.
But Dr. Alexander, I know these people are called as COVID howlers, right? COVID howlers because, over, many months, they continue to have symptoms. But like you said, some of them probably have, very mild symptoms like fatigue, fever. But we have seen that they can come up with neurological problem, they can come out with renal problems, they can come out with cardiac problem, as they mentioned. And what I feel is, these COVID howlers, they are becoming a problem in many countries. I think in USA probably, the problem of course is COVID infection as such, but a big problem are these COVID howlers, requiring treatment, to be in the hospital and requiring health care.
You are absolutely correct. What Dr. Saroj was telling is regarding post-COVID sequelae.
Right. Yes.
There is a stage between the sequelae which will take its own time and the acute disease. Recovered stage. This is the long COVID stage.
Yes.
Once that stage is over, still the symptoms persist with the manifestations. These are leading to these type of complications like sequelae.
It's a bad manifestation
This
of
is bad
COVID.
manifestation.
Yeah.
Yes.
Especially it is affecting the lungs.
Yeah. The next question is to Dr. Shanti Alexander. This is about children. How can we say definitely that a child has got infection by an Omicron variant if we cannot diagnose this variant by the available RT-PCR test?
I think it's a theoretical question. If you are suspecting anybody, including a child, to have COVID infection, we are doing the RT-PCR for confirmatory test. And till the time that a special facility to detect the Omicron genome is not available, it doesn't matter. Primarily, the treatment for COVID infection, Omicron or otherwise, is supportive care. It will not make a difference whether we identify whether it is Omicron or not.
The next
The management is the same.
management remains the same.
Yes.
The another question is again about children, is about vaccination. If a child has been affected by Omicron variant COVID infection after the first vaccination, and the infection was asymptomatic or mild, does the schedule of vaccination change? Do the child need to wait for a period of time before the second vaccination?
As the CDC is recommending, once a COVID infection is confirmed, either before any primary vaccination or in between the two doses of the primary vaccination, once it is confirmed, we wait for 90 days, as Dr. Alexander also said. So, if the child is asymptomatic and it was never identified and confirmed as COVID, the child would have probably taken as per the schedule. But once it is confirmed, we wait for 90 days and then take the dose if it is due at that point.
Thank you for clarifying that. That's a very important information for the parents. Dr. Arjit, next question is for you. Is it possible for a family to have infection with different variants of COVID-19 at the same time?
This is again a very theoretical question. And actually, when I was listening to Dr. Saroj and Dr. Shanti, we need to understand that Omicron is just the name to give a new name given to a new variation of COVID-19. The virus remains the same. The potential target or entry remains the same. It is now can be considered another variety of virus which enters through our body through respiratory. So these are called as respiratory pathogens. Now the question is that who is competing with whom? Means whether Delta is competing with Omicron or Omicron is competing with another strain. These are all theoretical points only. What is very clear to us that when a certain germ is spreading with a high contagiousness, just for a simple statistics, let me explain that Delta is 4 or 5 times more severe in nature, but at the same time, 4 or 5 times less efficient in spreading from one person to another person. A very simple statistic called as secondary attack rates. So secondary attack rates is almost 4 times higher in Omicron. So it's very likely that in a family, if one individual is affected by Omicron, the other individuals are bound to be affected with the same strain. It's not like mixed bag of worm is competing between each other and affecting individual members of the same family differently. No, that's not true.
Thanks for that reassurance. The next question is related to some adverse effects that follow vaccination. I have developed lymphadenopathy, cervical, swelling of the lymph nodes in the neck following the first vaccination given to me for COVID-19. It is still persisting. Can I go and take the second vaccine with the lymph nodes still there?
Yes. See, this is, this is the enlargement of the lymph nodes. Enlargement of the lymph nodes, sorry, is a known side effect with the vaccine. And it can persist, for days or for months. Now, and the person can take the second dose. There is no contraindication to this one. The problem comes in the females. I'll tell you why. Because, usually when these things used to happen, they would think that probably they have cancer. Because, cancer breast, the lymph node gets enlarged in the axilla. So, and it was very specifically told that if you have no other symptoms, we suggest that there is carcinoma breast, don't worry about it. So, if male, right, this one? So he should not worry about it at all. He can go and take his second vaccine, second dose.
A lot of the members in this group listening to this session are asking about approval of co-vaccine given in India. Are there any official guidelines about it? Approval of co-vaccine in Kuwait?
In Kuwait?
Yes. I have not
It's a
seen
little
any.
tricky question till now.
No.
Till now, no.
No. Yes.
Sir will be able to answer this better. We asked this question when His Excellency, came.
Yes.
I asked this question, remember?
No, we have still not got the official confirmation yet. We will inform the public as and when we get it.
Yeah.
The other question is related to booster. I think your point about the booster and the fourth dose has gone home. If one has received 3 shots of vaccine, including the booster dose, is a fourth dose or booster necessary? And if at all, if it is necessary, what is the time period it should be taken?
I think I answered that question there, but again, we still do not know enough about the third dose. I should take the third dose booster. So, it is too early to say, that whether we should take a 4th dose booster or not. There is no CDC recommendation yet. We have yet to see, how long the immunity lasts from the 3rd dose booster. So we don't know. But many countries, like I said before, they want to give, but that's an individual decision.
The other question is related to RT-PCR testing. Dr. Barki Alexander, what do you do when you find persisting positive RT-PCR test? When the second test is done, not for disease status, but for purposes like travel. So what is your advice regarding that? It means initially test was done, you are positive, you did not get you came out of the disease, but you want to travel, you are still positive.
Here the time interval is important.
Yes.
The RT-PCR positivity can persist even if the infectivity of the organism has been disappeared. This is a point which has been misunderstood by many people. As the RT-PCR comes positive, he is labeled still as a patient. How long this will persist, it is not yet clear. But it is not several months. I think it is maximum 92 days. Am I right, Dr. Saroj? Yes. 90 days or something like that.
Yeah,
it is not several months.
Yeah, I will add one point because Dr. Barki has said, and in this regards, nowadays when a patient is recovered from COVID illness and discharged from hospital, it's not mandatory to do exit swab. We are not doing exit swab for the very same reason which Dr. Barki sir has very clearly highlighted. And sometimes a person may continue to have those fragments of the dead virus, and that may remain positive for a considerable period of time, although it will be very difficult for us to say for how long. But yes, there are some individual who has recovered from the illness and completely cured of the disease still continue to remain persistent PCR positivity. And that may have some bearings with particularly travel requirements.
See, I will add to that one. Like you already said that, once somebody has COVID, so as a follow-up test, we do not do RT-PCR or a lateral test, whatever it is. And the person, like Dr. Arjit mentioned, that the RT-PCR can remain positive. So as far as we are consider, that the person is considered non-infective. I call it the period of 10 plus 3, meaning what? That if the fever, the fever is taken as a criteria. If the fever the person does not have fever on the 6th day, so after 10 days he would be considered, non-infective. Suppose the fever persists up to 10 or 11 days, so or 12 days. One day after the fever, he will be considered, non-infective. So we don't need to do an RT-PCR. Now, the practical implication of this is, you said before travel, many countries have, they have already said that, and if you can document it, if they have COVID-19 infection 3 months before travel, they should not do an RT-PCR. The reason being the test will be positive. So they just have to have a certificate saying that, they had COVID infection recently and they are exempted from doing an RT-PCR.
Thank you, my panelists, for an entertaining as well as invigorating and an educative exercise on a lot of aspects on the new microvariant, the Omicron. As my colleague Dr. Saroj Grover beautifully put it, we have probably learnt a lot from our experiences. We are much more clearer in our diagnostic, management, and preventive protocols. So we would probably are better off now than when we started in November 2019.
Doctor?
Yeah, at the request of my president, a lot of information is spreading in social media and in other channels about a lot of managements, diagnostic issues, safety and inefficiency of vaccines, and frightening messages about severity and vaccine-related disorders. My request to all listeners of this particular seminar is, do not believe every message that you have received on social media as a true Bible or true expert opinion. Please check the veracity of the origin of the particular details, including the so-called scientific studies or studies quoting international organizations which are reputed, like the World Health Organizations, UNESCO and all. Please go through the original reports to confirm if you are receiving information related to a particular vaccine, diagnosis of disease, origin of a new mutant, various participations that are happening. And always you can check with the experts. They can tell you whether the information is correct, authentic, and whether the medical management advised by the group is good. It is a good standard care management, standard operational procedures for protocols to be followed in the case of infection management, vaccination, and other standard of care. So use your intelligence and your knowledge to decide about spreading messages about COVID-19 disease, its management, and vaccinations. Once again, thank you, my dear colleagues. You have been wonderful in taking this short time and coming here despite your busy schedule and answering so many questions related to, including those from me, about COVID-19, its diagnosis, management, and most importantly, about vaccination. I would like to conclude by saying there is a tunnel. It may be long, like Dr. Saroj
Shortened.
said, but the tunnel has become short, and there is definitely a light at the end of the tunnel.
Yes.
Thank you, everybody. My special thanks to the Embassy of India in Kuwait and the ambassador and his team, and to Dr. Amir Ahmad, the president of Indian Doctors Forum, and all the office bearers of Indian Doctors Forum who are present here, as well as and silently working towards control of the disease of COVID-19 in Kuwait. Thank you, everybody. My thanks to my colleagues in the medical profession and allied sciences for continuing their untiring work towards eliminating the disease in this country and everywhere in the world. Thank you.
And may I add one thing more? I would like to thank Dr. Menon, for chairing this session. And really, it was, I would say that I had a great time, interacting and answering. Thank you so much, and the thanks are from all of us.
Thank you so much, Dr. P.S. Narayan Menon, Dr. Arjit Chattopadhyay, Dr. Saroj Palagrover, Dr. Varke Alexander, and Dr. Shanti Alexander for your time and participation. We are grateful to you for providing us the most important and accurate information on management of COVID-19 and its variants. With this, we come to the end of this program, and on behalf of the Embassy, I thank Ambassador of India to Kuwait, His Excellency Shri C.B. George, for his support and guidance, Indian Doctors Forum and its members, Indian associations in Kuwait, and everyone who has joined us live and media fraternity. Thank you once again to one and all. Good night and Jai Hind.